at the Minnesota Council on Foundations. This webinar is being presented by MCF in partnership with the Minnesota Council of Nonprofits, the state of Minnesota, and the Center for Disaster Philanthropy. The idea for this webinar came from conversations with MCF members, including MCF's Disaster Philanthropy Working Group. I want to give a big thank you to everyone who contributed to developing this webinar today. This webinar is being recorded, and it will be posted on both the MCF and MCN website later this week. Before we get started, I want to provide a little bit of framing for this webinar. At MCF, we've been thinking about our own preparation around coronavirus in two ways, internally and externally. Internal is focused on how we as a staff and organization may need to adjust our work and operations if, for example, we had to work remotely for several weeks. The external is focused on how we would continue to serve our members and the broader independent sector. This webinar, to help prepare the sector, is an example of one external way we are responding. I think the content of this webinar will have a similar dual focus, helping nonprofits and foundations think about their own internal continuity of operations, as well as thinking about the external services they provide and how needs may evolve and even increase as a result of an outbreak. It is important to mention that as we all prepare for coronavirus, that we also make sure we do this work in a way that is inclusive and rejects dangerous xenophobic and racist sentiments that have been growing towards Asians and Asian Americans in the wake of this outbreak. I encourage you all to be mindful of the way you do your preparations and talk about your work so that we as individuals and as a sector do not contribute to false narratives around Asians and Asian Americans. In this webinar, we are really fortunate to have Tanya Gulliver-Garcia, the Assistant Director of Major Initiatives for the Center for Disaster Philanthropy, to share her content expertise. We're also thrilled to have Amanda Simpson, the Chief Operating Officer at the Governor's Office, to share a state update. We'll start the webinar by hearing some brief remarks from Amanda on how the Governor's Office and the state are preparing for coronavirus, and then I'll introduce Tanya. And Amanda, I'm going to find where you are to unmute you, and then I'll turn it over to you. 1 second, let me just find you. I know people are joining, so it might take me just a minute. Let's see. There we go. Amanda, I'll turn it over to you.
Thanks so much. Hi, everyone. My name is Amanda Simpson, and I'm the Chief Operating Officer for Governor's. I want to thank Katina and Susie for asking me to participate in today's call, and thank you all for the important work you do every day. I've worked in the Governor's Office for 16 years, and one of my many hats is emergency planning and continuity of operations. We've been updating our continuity of operations plan, what we call the COOP, and the accompanying pandemic plan for our office for the last few weeks. I learned about continuity planning working for the Pawlenty administration during the H1N1 pandemic, and I'd like to share a few important thoughts with you that make me feel better while doing this work, which can be stressful and scary for everyone involved, especially for employees and clients who may feel powerless. First, Minnesota has a strong disease surveillance system in place that includes partnerships with our hospital and clinic systems as well as local health departments. The Minnesota Department of Health stood up their internal preparedness team a month ago and are working around the clock to provide the most current information to the public and to state agencies. Their Joint Information Center is up and running, and they're holding daily media calls and weekly calls with continuity planners, emergency managers, and education partners. Second, the Governor's Office is in hourly coordination with the Departments of Health and Public Safety. There are no current cases of coronavirus in Minnesota, but we are actively preparing for the possibility of the virus in our state. The governor and legislative leaders have committed to working on funding for coronavirus efforts in a bipartisan manner. In DC, the House and Senate just agreed on an $8.2 billion emergency coronavirus bill. We are getting ready in a serious and thoughtful manner. Third, Minnesota foundations, nonprofits, and state government are communicating and working together. The Departments of Health, Public Safety, Minnesota Management and Budget, and the Governor's Office are working with state agencies to identify their external stakeholders and develop communication plans around a continuity event. If there is an event that affects nonprofits or foundations, those agencies will reach out to their external partners. I've attended a lot of meetings in the last 2 weeks on this subject and will need to step off this call a little early to attend another one, but I hope it helps to know that I am so impressed with the level of preparedness, the thought that is going into every action, and how deeply the people in our state care about each other. That being said, we can't think of everything. So if you think of something that's getting missed, please feel free to reach out to me. My email is amanda.simpson@state.mn.us. And if I can't answer your question, I'll get you to someone who can. Thank you so much for your time.
Thank you, Amanda. Really appreciate it. MCF and MCN both are very appreciative of the partnership and communication from the governor's office on this important topic. If there are specific questions for Amanda, we'll collect them and share them with her, since as she shared, she's not able to join us for the Q&A today. And then we can share her responses as a follow-up. Now I have the honor of introducing Tanya Gulliver-Garcia with the Center for Disaster Philanthropy. The Center is a national philanthropy-serving organization that specializes in disaster giving and has been an invaluable partner and resource to MCF and its members. Tanya will provide us with a status update on coronavirus and share the internal and external considerations nonprofits and foundations should be thinking about as they prepare, as well as some personal considerations we should all keep in mind. After Tanya's presentation, we will have 15 to 20 minutes for questions, and we'll ask that you use the chat feature. MCF staff will curate the questions as we assume there may be quite a few. And as I mentioned, we'll send any state of Minnesota specific questions to Amanda for follow-up. With that, I am pleased to introduce Tanya. Tanya, thank you so much for being here. And again, I'm just going to take a minute to find where you are so that I can unmute you. Just 1 minute. And I'm not seeing you on the list. Do you want to just try speaking and see if we can hear you? Let's see, I had you down as caller 3 and I don't see that. Sorry for the technical difficulties. Is that
thing? There we go.
There, thank you.
You can hear me now. All right.
Yes.
And Katina, my slides aren't advancing, but I want to make sure you're going to advance them. There we go. Perfect. So this is our hashtag CDP for recovery. If anyone wants to share a tweet or something on Facebook, then everybody at our office will know I'm actually working. Next slide. So I'm going to start just with a very basic. I know we're hearing a lot about coronaviruses, but I feel like there's still a lot of confusion. So there are many types of coronaviruses. Probably all of you have had one. They are very common and cause about 15 to 20% of all our colds, but they can also be more severe, such as SARS or Middle East Respiratory Syndrome. Next slide. So this specific coronavirus has been given the name Severe Acute Respiratory Syndrome Coronavirus, or SARS-CoV-2, because it is very similar and related to the original SARS virus. The disease that's caused by the virus has been named Coronavirus Disease 2019, so that's when you hear COVID-19. But if I say coronavirus today, I specifically mean SARS-CoV-2 or COVID-19, this virus that we're concerned about. The numbers of cases are changing almost minute by minute. Johns Hopkins has a great list and database of all of the cases, but this is what we had as of about 10 o'clock this morning. So mainland China, 80,270 cases, of which 49,928 are recovered. That's about 62% of all cases in China have recovered, and just over to almost 3,000 deaths. Those deaths are primarily older people and people with coexisting or previous illnesses. South Korea, we're seeing a massive increase, and this is mostly linked to a church where an individual was what we call a super spreader. And so she infected a huge number of people who then went on to infect other people. Iran also increasing, in Italy. Travel warnings came out very strongly today for Italy in several communities or countries, and they also shut down all of their schools and universities as a way of stopping the virus. In the US here, we're at 128 cases, 8 of which have recovered, mostly people who were repatriated early days when the virus first got announced, or who were on the Diamond Princess cruise ship. And we've had 9 deaths all since this weekend, and 8 of the 9 are in King County, Washington. So this is an emerging virus, and so everything you heard 6 weeks ago, throw out, because it's no longer true. But they have done a study of 72,000 cases in mainland China, where they found that the case fatality rate, the CFR, was 2.3%. Last night, the WHO came out and said that they think it's actually 3.4%. The better research we do, the more this spreads to other countries, the better understanding we'll have. If a lot of people have very mild symptoms and they're not going to get tested, they're not getting counted as a case overall, and so we're not able to determine that percentage of fatalities. So as I said, most are mild. If somebody was critically ill before they got this virus, the case fatality rate was almost 50%. And then older people over the age of 80 were 14.8%. So those numbers really skew the 3.4 or the 2.3. The majority of people are going to get a very, very mild case of this if they get it at all. Some of them will be so asymptomatic they won't even know that they have it. It's more transmissible than SARS, but it's less deadly. The flu, by comparison, has a case fatality rate of about 0.1%. Next slide. This one's a little hard to see. It's from the New York Times. It's updated every day, but just to give you a sense of states that do have cases right now, the majority are in California. That's the #1 state. The fastest growing group is in Washington state. Next slide. So when I'm going to talk about planning for you as an organization, for you as a person, for you as a family, one of the things that is important for all of these is supply chain challenges. So we have a strong dependence on Chinese manufacturing and imports. This includes a huge number of components of medication. So if you're going to get medication refilled anytime soon, you want to get a 3-month supply. We also have a practice of just-in-time manufacturing. So that has created some limited supplies, which is exacerbated by panic purchasing. So people are buying up every N95 mask that you can find. Amazon's been sold out since the middle of January, and Purell is now going for $100 a bottle on Amazon. The other considerations for planning are, if you're asked to quarantine, you're exposed, you're at risk, you're not showing any symptoms, it's going to be 14 days. If you're sick and you get put into isolation, whether that's at a hospital or at home, that could be up to 3 weeks or more, depending on your pre-existing conditions. Next slide. So this spreads very commonly, like most viruses do. It is airborne, and it can also be transmitted on surfaces. The estimate right now is that it's about 9 days that it can live on a surface. So, you know, things that at the beginning we thought were no risk at all, like packages being sent through the mail, or, you know, being in a room that somebody had been in before, are now considered to be at risk. The symptoms are very common to a common cold unless you have those pre-existing conditions, in which case it can go into breathing difficulties, pneumonia, kidney failure. But the majority of people are most likely going to have very mild cold or flu symptoms. So some do's and don'ts. Some of this is what you want to be doing in every flu season or just generally for good hygiene. Washing your hands with soap and water. We're often told that we can use hand sanitizer. We can, but that's not the preferred way to get rid of this. Soap actually breaks down the outer layer of the coronavirus itself, which makes it much, much easier for it to get washed off. If you think there's any risk at all, you want to use paper towels. Every person gets a separate hand towel. Touch your elevator buttons with knuckles, bump elbows. Don't give out business cards. And the CDC is asking if you're sick to call the doctor's office before going in so that they can take all necessary precautions so that you're not infecting somebody in the office or in an ER. And then in terms of the don'ts, they're also asking that you please don't buy or wear a mask unless you are sick. So when the doctor tells you that you should be wearing a mask anytime you're out in public, that's the time to do it. The WHO came out yesterday and said they think the #1 way that this is being transmitted by touch is through money. So if you touch any money, wash your hands immediately after. If you know people who work with money, cashiers, that kind of thing, they should be wearing gloves when they work with it. The U.S. has a list of places that we shouldn't travel to unless it's absolutely necessary. If you do travel to those places, you will get quarantined upon your return for the 14 days. Don't dip the chip, don't share utensils, try to avoid your bare hands whenever possible touching things. So what does a 14-day quarantine look like? Thinking about, do you have food and water? Some of these are things that we would do 3 days, 5 days if you were at risk for a disaster, a major blizzard. I'm in the South, so a hurricane. But people might say, why would we need water if we're talking about a virus? If we have a huge outbreak, a huge contamination, what we will see is that a number of people are going to get called off work, and that could include people who manage our water treatment plants. So if anything goes wrong, they're not going to be able to treat the water, which means you could get switched to a boil water advisory or being advised not to drink it. Pet food, medications, all the hygiene supplies that you think you're going to need, and cash, which you want to handle with gloves, but just in case you're not able to get to banks or banks get closed. Other considerations. How are kids going to access education? Lots of schools are taking days off right now and having professional development days to train on how to carry out remote education. For you yourself, can you carry out your work at home? Do you have enough sick leave if you have to take a 14-day quarantine or you get infected? What policy are employers going to implement? So that's something you all should be thinking about. Pets may need to get quarantined. So if you have a pet, a dog, how's it going to get walked? What's that going to look like? And I don't know about you, but I do not want to be stuck inside a house with my kids for 2 weeks. So do you have enough stuff that's going to entertain your family for 2 weeks, 24/7 together? So then moving to the organizational side, I want to talk a little bit about continuity of operations plan, which always gets called a COOP plan, even though plan is the last letter or the last word. So it's a collection of resources, actions, procedures, and information that ideally is developed, tested, and then ready for the next major disruption of operations. It is a living document. It shouldn't be something that sits on a shelf. So it should be reviewed, it should be practiced, and it should be revised constantly. I'm hoping that many of you have developed this, but if not, we'll talk about some things that it should look like. There's 4 stages of a COOP. So readiness and preparedness, how are you getting your team ready? The moment you move into implementation in the first stages, the continuity itself, what your operations look like, and then your recovery, how do you review it or revise it as necessary? So normally when you're looking at a plan, you want to look at what are the likely hazards in your area, do a complete assessment and inventory of resources, and that's both the skills that people have, the financial resources you have to cope with something, but also the physical resources, making a list of every chair, table, computer, cell phone, piece of equipment that's in your office, having it categorized, having an on-site and off-site, an electronic and paper backup of all your contracts files, important contacts, having a staff phone tree. If you think cell service is likely to go down in your area, text can still sometimes get through, and arranging with somebody who's out of state to be the phone tree contact for your organization, and everybody tries to text that person rather than trying to work within a very busy, overloaded system. Developing a crisis communication plan, and then what I like to call the hit by the bus option. If I'm a staff person at your organization and I get hit by a bus today, who can do my job tomorrow? Who has all of my passwords, all of my skills, all of my knowledge, or what combination of people can fill in and try to make that happen? So normally you want to have one person or a small group of people who are in charge of making a decision. At my last job, that was me. Living in New Orleans, we had several activations, and this could be as simple as the mayor has asked people not to go to work today, so everybody please take your laptops home tonight, or, not to go to work tomorrow, take your laptops home tonight, work from home. Letting people know that key meetings are canceled. So somebody needs to be that person, and it depends a lot on the disaster. If this is an issue of your entire board steps up and quits, or your entire staff leaves, then you're going to want to have your crisis communications moving very quickly so that you can halt any rumors in the community. If it's a flood or a blizzard, you don't need to necessarily move into crisis communications, but you want to put notices about your office being closed, when staff will be available, what services have been canceled, how operations are continuing. And this just helps you move smoothly into your continuity, your operations itself during the disaster time. So some things to think about. Who can write the checks if your CFO and or your whole entire electronic system is unavailable? During the floods in Baton Rouge in 2016, our CFO was without power, and we only had the ability at that point to write either manual checks or on our electronic system. But that changed who had signing authority, because if the CEO wrote the manual check, he no longer had signing authority on that check. So do you have enough redundancy built into your system? Where are staff going to work? Are they remote from home? Can they relocate to another office? Is that in this community? Is that in another community? Is there a like-minded organization that can share resources or share space or services? Can someone be tasked to do backup payroll, for example, if your organization is really hindered? What services need to be modified? And then how are costs being managed? Are things more expensive, and how are you managing that at this moment? And then after you have your disaster or your event, you want to hold an after action report. An AAR is just really a chance for you to all sit together and to talk about what worked, what didn't, what needs to be changed, and make sure that that's across the board. So if you have clients, if you are a foundation and have grantees, find out from them what worked, because maybe something felt like it was working to you as a staff member, but for your clients or your grantees, it wasn't working. And then suggest new areas to examine when you are editing your COOP, and then rewrite it and practice. There we go. So COOP in the time of COVID-19. If you don't have a plan right now, this is the part you want to pay attention to, and then go back and write your plan at a later date. So biggest impact, as I mentioned, is going to be quarantines. If one staff member, or if you have a client or a visitor or a vendor that's been in your office, it's possible that everyone who had contact with that office is going to be quarantined. So if you have a 30-person office and everybody was there that day and you had a group meeting, you're all under quarantine now for 14 days. So how is your staff going to carry out work? Do they have remote access to shared drives? A lot of people who are using SharePoint or systems need to be on the network to be able to access them. Does everyone have a work phone, a laptop, home internet, a way to work? My last assistant, when she left me, said the best part about her new job was that it was a desktop and a desk phone, and she didn't have a key to the office. So she could literally only work 9 to 5. In an instance where she was quarantined for 14 days, she's not going to have income for that 14 days because she would not be able to work. Do sick staff have enough vacation time, or are you going to put in a policy around COVID-19, knowing that the length of the illness is so much different than what we're seeing? And is there a way to do payroll without staff working in the office? Do you have an outside payroll organization? Can someone sub for you? Is there a way that one person can do this at home remotely? Things to think about before you actually end up locked in your house instead of being able to go to a bank and make a decision. If there's only a partial reduction of staff, can you meet the needs of your clients or your grantees without a full staff complement? Can another agency shoulder some of the load? Can you work with someone else who does a similar service? Can a foundation find another foundation that will do the management of their grants for them for a short period of time? What can be reduced or delayed? What's essential? What's a luxury? So do you really need to have a grantee visit right now? Can you operate with shorter hours? That's a really great conversation to start having before you actually get to that point of having to implement. And then what are your new needs? So if for NGOs, are your clients more vulnerable? Do they have extra needs because of that quarantine? If people are working hourly work, which a huge part of this economy does, then their chances of getting fired for not being able to go to work are increased unless they have some kind of protection. If they're getting laid off or reduced hours because the restaurant isn't seeing as many people or the hotel has a decrease in vacancies, things being canceled because of the fears, what are their needs? And if they got quarantined, do they have access to food? A lot of people can't come up with 2 weeks of food and medication and pet food and have that just in case something happens. And then how does service delivery need to change? If you're a meal program, can you make it remote outreach? Can you partner with a Meals on Wheels or someone else who's going door to door already to deliver your service rather than having clients come to you? And that reduces the congregation factor, which is also a concern for spreading the virus. Are NGOs in need of extra and flexible resources? For foundations, is this the time to reach out to your grantees and say, hey, what do you need right now? How are we able to assist you? Can we give you some extra operating funds, or can we change the criteria or the parameters of one of your grants to make the funds you already have more flexible? And then for foundations, are you trying to launch a COVID-19 fund? We have lots of resources, and I'll share some of those, about ways you can get that ready now and put it in place. And then how are you going to manage that with limited resources? We know from disasters like the California wildfires that when the American public wants to contribute, they will do so, but it takes a huge demand and human resources to be able to answer the phone, to process donations, and that kind of thing. So this is one of our standard slides. We work to get people to think about the full life cycle of disasters. We find through our research that the majority of foundations and the majority of individual household giving is done in that reactive stage. It's not done strategically. And so we are really encouraging people to look at the full stage, the full round of disasters, and think about how they could be giving money in a way that is more planful, I guess. Can you think about before a disaster happens? Again, this could be part of your continuity of operations plan. If you're a funder, what are your likely funds going to be? What are you likely to respond to? Can you invest money in preparedness so that it reduces the needs on the community right now? And then how do you move into recovery? What does that look like? Next slide. So we often hear from funders that they're not disaster funders, and our argument is that everyone is a disaster funder. But disasters tend to fall outside of normal grant making. And so until a disaster hits in the community or the area that you fund or that you're based in, people tend not to think about it. But if you are a housing funder, if that's your main focus, shelter is the first need that people have after a disaster. If you work with vulnerable populations, we know that low-income folks, communities of color, seniors are the most vulnerable following a disaster. children, educational services, mental health services, health services. So we really encourage people to think about how they can transition the work that they're already doing and the interests that they already have into disaster funding. And that's the same if you're managing donor advised funds. If you have a donor that likes to give to healthcare, they can give to healthcare in a disaster. They don't have to just give outside of that disaster time. Next slide. So we partner with Candid, which used to be the Foundation Center, but Candid and GuideStar merged together about a year and a half ago. And one of the things that they do for us during a major disaster is to look at the research, how much money is coming in. So this actually was yesterday, and then some more donations came in actually from some Korean conglomerates. So we're actually just over $1 billion. So that's $1 billion. And these compare some of the more recent disasters that they collected for us, things that we thought were raising a ton of money. But obviously an epidemic or a pandemic is not the same as a natural disaster. So if we went back to the Ebola outbreak of 2014 in West Africa, there was only $363 million announced over a period of 6 months. So that's still only 1/3 of the COVID-19 response, and we've only been collecting this since early January. And then what's interesting about this is the type of funders that are stepping up. In most disasters, we see companies step up first and foremost. And if we look at companies and their foundations, they have contributed 95% of all the pledges and 92% of all the dollars. So there's lots of room for other foundations to step up and to assist in this kind of response. So some ideas that we have for funders on how you can help, the kinds of organizations, the kinds of activities. Think about organizations that are working in areas with poor access to regular medical services. That could be internationally, it could be inner cities, it could be rural communities where there just aren't enough doctors, there just aren't enough clinics, there aren't enough services, and where there's more likely to be pre-existing conditions. We know folks that are homeless, we know Native communities often have higher medical pre-existing needs than the general population, and that's going to make them more susceptible to this infection. Water, sanitation, and hygiene, WASH, important both domestically and internationally. So looking at those who are able to help limit the spread of any kind of infection. The majority of 501c3s that are operating right now and international organizations in China and other places are focusing on this as well as the provision of medical supplies. Look for organizations that are going to have significant capital needs. As I said, these medical supplies, masks, gowns, gloves, other essential personal protective equipment, the numbers that were just released for the US are astounding, let alone international numbers. What we have been seeing in China, there was over 3,000 healthcare workers that were infected. Many of the people who've been infected so far in the US are healthcare workers. There is a huge percentage of a fire department who are also medics who responded to the Kirkland nursing home in Kirkland, just outside of Seattle, Washington, who are now on quarantine or infected in isolation because they went into it not knowing what it was. And even after they knew that it was an infectious disease or suspected COVID-19, they weren't wearing their proper equipment or weren't wearing it properly. If you are into research, this is an amazing time and opportunity to get into research. China shared everything they knew about the virus as soon as they could. And so a huge amount of research is taking place. They were able to identify it, replicate it within a few weeks. Scientists are literally working around the clock and sharing their data and their research together. So even though they're in different countries, they're working together and cooperatively. If we find a vaccine, and there's some that people feel are ready to test right now, we're not going to have a vaccine for another 18 months. If there's no money invested in vaccines, we might not have another vaccine for 3 or 4 years. That means this has no chance of moving to what the flu is right now, which is a preventable, manageable disease, as opposed to something that our best hope right now is containment, because we have no way of treating it. At the same time, all sorts of other research has been put on hold so that those scientists could dedicate their resources or their time to SARS-CoV-2. But it's really important that funding continues. It's one of the big worries in the Congo right now with Ebola, is that all the money is going to be taken away from them, and they are so close to stopping the outbreak. This past week, they had no new cases or no new deaths in the Congo, which is great after over a year and a half. But if that money is taken away for this new outbreak, then that runs the risk of something else coming back. And then finding ways to support quarantined individuals. It can be very challenging to be trapped in your house. I know a lot of introverts who are very happy right now that maybe they're going to have to stay home and avoid social functions. But for most people, quarantines can really trigger mental health issues, not getting to go shopping, not getting to go to social functions, to work, see their families. So anything that can help make quarantines more bearable or mitigate social isolation. And that includes supporting them after the fact. If they've lost income, if they lost housing, if they lost employment, if there's been family breakdown or problems, it's important to make sure that that recovery stage also includes the folks that were quarantined. Just a few other things. Take the long view, think about the full range of needs. This is an emerging disaster. What we know from our friends at Give to Asia is that the needs have changed. So what China was going through in early January is where we are now. What the needs are in China now, we're not going to have for a few months. So just be prepared for that arc. Private philanthropy has the opportunity to do things that government agencies and government funders cannot. You can be way more innovative and way more flexible with your funding. As I said, all funders are disaster philanthropists, even if you don't normally work in that area. Look at ways to build it into your mission. And then ask the experts. We are happy to do this kind of thing or to give advice to organizations and funders as you're exploring getting into this. So I'm not sure how many people know about us. In some ways, we're a good secret, but we do 3 types of work. We do educational resources, grant making and recovery, and consulting. So the consulting includes this kind of work with funders and NGOs, letting them know about disasters and how they might get more involved. We also have a list of clients for whom we provide curated lists after a disaster of NGOs that are responding, or funds that have been set up by community foundations or local corporate foundations in the community. We have a number of educational resources, and I'll share those in a second. And then we also have our own grant-making funds that we grant out generally in most disasters 6 to 12 months after. With COVID-19, we'll be granting out a little bit faster, but still focused on early recovery work. Next slide. So some of the things that I want to draw your attention to, and when you get the slides, these are all links, hyperlinks. So we have our Disaster Philanthropy Playbook, and I'll talk about that more in a second. Our website has all sorts of different blogs, including a weekly blog on disasters around the world. We have issue insights, which look at different kinds of disasters, different kinds of funding options. We do have one that was written recently on pandemics and infectious diseases. And then we have disaster profiles. So we have been updating our COVID-19 profile since mid-January. So we like to say it's like your daily newspaper, not CNN. It's not up to the minute breaking news headlines, but it is updated on a regular basis to provide people with information, key dates, and suggestions on how to help. We have a series of webinars, and we are offering our own webinar tomorrow afternoon at 2 p.m. Eastern, and information about that is on our website. And that will have somebody from the National Center for Disaster Preparedness, the President and CEO of the CDC Foundation, and the Vice President at Give to Asia. And they'll be talking really more about philanthropy and what the role is for philanthropy, but everyone is welcome to attend. Our annual report is the Measuring the State of Disaster Philanthropy. We've been doing that for 6 years now, and it looks at how funders give, where they give, and what they give to. I find for NGOs, the map is a great way to find funders that might be funding in your area. You can search by year, you can search by funder, you can search by geographic location, you can search by a keyword such as food or children's services. And for funders, it's a good way to get some unique ideas about grantees and what they might be doing. And then finally, we have our U.S. Household Disaster Giving Report, which interviewed U.S. households and looked at what they gave in 2017 and 2018 towards disasters. It turns out that individuals are giving about $3 billion a year towards disasters, the majority going domestically and about 4% going internationally. Next slide. So this is our playbook, and you can access it from our website or at the link that was provided. You can create your own playbook so that as you find different strategies and different information that speaks to you, you can save them so that you can go back to it. It's full of tip sheets, it's full of resources, it has different kinds of strategies for populations or for kinds of disasters, kinds of response that you might want to have, and a huge section on collaboration and how to work together. Next slide. One of the most recent sections of that is the Strengthening Local Humanitarian Leadership Philanthropic Toolkit. It's a huge mouthful. But this is to think about the concept of localization. It's written primarily from an international context, but it's super helpful from a local context as well. So how can we as funders really listen and value the voices on the ground? How can we not give a whole bunch of widgets for a grantee to make when what they really need is to be handing out widgets that are already made? How can we say, you are the experts, here's some funding, this is the need we want to try to address, you tell us how that's going to happen? And really putting power in the hands of the local folks on the ground who really know their community best. As I mentioned, we often make curated lists for funders, for our clients. And so we just finally set up and published formal guidelines. We've always had them, we just never made them public. So there's information on funders, on what we do, what the lists are like, how we do it. And there's also information for NGOs. So if you want to get on our list, so if COVID-19 hits your area and you're going to be responding and you want to make sure that funders know about you, then you're going to contact me and we'll get connected and we'll get you on the list. And one of the ways that we're doing that early in the blue sky time is what we call CDP pre-check. It's a lot like TSA pre-check. It's doing due diligence on grantees and NGOs before they get added to our list, right before we're going to make a grant or recommend them to one of our clients. And then I guess we'll turn it over to Katina.
Yeah, thank you so much. This was extremely useful information. Really appreciate you going in depth into how we personally think about it and then also how we think about it as organizations and externally. As we suspected, we do have a lot of questions. So going to try to summarize some of them. Some of them maybe go together. There are a couple different questions here about organizations that, like museums or organizations that host large events, how they might want to think about operating if there is an outbreak or not operating, like how they'll kind of know when to think about maybe closing a museum or canceling an event. If you have any advice or tips on that, is the first question.
Sure. So, as some of you may know, peak grant making, which was supposed to start this weekend, got canceled yesterday. They canceled for two reasons. One, the conference no longer became viable because of the number of organizations that have put a prohibition on travel, and also because Seattle, or the region emergency management, said to them that it was no longer a good idea with the way this virus is spreading in that community for them to bring together a large number of people. So your best advice is to stay in touch with your local municipality or your region, state emergency management folks, and they are the experts who will advise you, as well as to look at CDC for any local travel advisories that are put into place.
Thank you. We have another question here about those that operate kind of critical human services like a shelter. If there are residents in a shelter that become ill, how to handle that with staff, knowing that you obviously want to protect your staff as well. Do you have advice on kind of balancing the interest in serving and the interest in safety for staff?
So it's definitely a challenge. I was in Toronto during SARS, and the understanding was if there was an outbreak at one of the major shelters, whoever was inside was going to be locked inside, and masks and other equipment would be dropped off for them. And that included a very long supply of body bags. Homelesshub.ca has written a book or a report on how to deal with pandemics in a shelter situation. So I really encourage you to take a look at that. This is something that all shelters should think about, not just for COVID-19, but also for norovirus or other things that could outbreak in close quarters. But chances are folks are going to get quarantined together because you're going to need to have a certain amount of staff on hand to meet the needs of the clients and the shelter residents.
Thank you. We have a few questions about quarantines, both about kind of the probability that this could happen in Minnesota, and also if employers can legally require employees to quarantine if they're experiencing flu-like symptoms, and kind of what maybe what some best practices are around that.
Sure. So right now, quarantines have been somewhat voluntary. But an individual in New Hampshire went to an event in Vermont after being told they were required to be quarantined and infected somebody else who also attended that event. And now everyone who attended that event is in quarantine. So they are starting to become stricter and are looking at whether they're actually going to have to implement some kind of requirement for quarantine. Certainly with everybody who came back from Wuhan or from the Diamond Princess, they were all forced into quarantine. They didn't have a choice at all. They were maintained in camps on military bases. As for employers, that would depend. That would really differ by state law. And I'm in Louisiana, and I'm not a lawyer or an expert on Minnesota law, but you can certainly require ill staff to go home. You can't require them to necessarily quarantine themselves, but you can prevent them from coming into work until they get a letter of clearance from a doctor.
That's great. Thank you. So there's a question here from, I think, a funder saying that, very appreciative of all the ways that you shared that funders can get involved, especially kind of financial ways they can get involved. Are there other ways, kind of in addition to financial support, that funders should be thinking about getting involved in this?
Sure. I think we have a big audience generally as funders. So what are we doing to share truths and messaging? How are we making sure our grantees are feeling taken care of? When I've had a disaster fund and had another disaster come through or approach, I've always called my grantees to find out how they're doing and what their needs are. So to see if something has changed. And sometimes they don't need the money, they just need that voice that someone's checking in on them, and that it's not, I think sometimes we have an adversarial relationship between funders and grantees, that it's not about that, it's about all of us working together. I think even within their own organization, reassuring staff, this is what we're doing, this is how we're going to do it, no one's going to lose their job if they get quarantined or if they get sick. We're making arrangements on your behalf. I was going to Seattle to present at Peak and was really concerned because I deal with a medically fragile child, and I also didn't want to get quarantined in Seattle for 14 days. My house, I'm fine. I'm stocked up and happy to live in my house for 2 weeks, but didn't want to be in a hotel with no supplies. And so, my employers really took that seriously and talked that out with me about safety, guaranteed that if I did get trapped somewhere on work travel, that they would cover my expenses. And that just gave me some assurances that I could continue to do my job in the way I needed to.
That's really helpful. Thank you. And I think we have time for a couple more questions. There's a question, just a practical question. Do you recommend that we stock up on 2 weeks of supplies, like as individuals? Are we at that point in Minnesota that people should be doing that?
I think we are at that point for 2 reasons or 3 reasons. One is the supply chain that I mentioned at the beginning. Some things are going to run out. The other is, as people panic, they're going to overbuy. So just make sure you have just enough for what you need. For me, I made sure I had extra water because I live in an area where boil water advisories are very common. I had extra medication and pet food. But this is going to be my excuse to actually go through my freezer and eat everything that I have in it so that nothing is extremely outdated. But you also want to get there before the outbreak happens, because what we've seen in Seattle is that stores like Costco are completely empty because everyone has panicked once it got announced. So if you can afford it, stock up on the necessary supplies and think about this, saving some if it doesn't come to Minnesota, if you don't end up getting quarantined, you want to keep a 5-day supply for any other disasters that come up. We're heading into flood season and in it in some places already. But then is this a chance to, donate it to a food bank if you just don't have the room for all of this in your house after the risk passes?
That's great. Thank you. There's a couple questions about short-term disability policies and if they can be accessed if an employee is quarantined. Do you have any knowledge of that?
I do not. Happy to look into that and share an answer, but I wouldn't want to give one right now. Once somebody goes into isolation, that means they're infected, and then short-term disability is more likely to come into play. But this is definitely something insurance companies are trying to figure out right now. The same with testing. Once testing is more available, how are they going to cover these costs that are really unexpected?
That's great. Thank you. I think we're almost at our time. I will close. I saw a question just about MCN and MCF's policies. I don't want to speak for MCN's policies, but at MCF we have been talking about this internally. If we needed to be quarantined as a staff, I think we can share a little bit about our thinking. We've drafted a very rough draft, just 1-page kind of plan for this that we're happy to share. I do think that our current hope, we've just upgraded our technology, so we hope that we'd be able to work remotely if we needed to for a while. And with that, I'm going to say I'm going to close our webinar because we are coming up on time, but thank you so much to our many partners for helping us develop this webinar, especially appreciative to Tanya at the Center for Disaster Philanthropy, to the Minnesota Council of Nonprofits, the state of Minnesota, and our Disaster Philanthropy Working Group. As a reminder, the recording for this webinar and the slides will be posted on both MCN and MCF's website. And again, thank you so much to our presenters, and thank you all for participating. I hope you have a great rest of your day.
Thank you.
Thank you.